Hello, everyone. We are Claire Abdellah, Maddie Connolly, Anna Herbst, and Maddie Miller. And today we're going to be discussing our prototype that is aimed towards decreasing nurse burnout. So we're going to go through our story, why we created our prototype, and how we hope that it fixes the problem. So our story just revolves around some statistics and numbers that we find alarming. So this is from a study published by the American Nurses Foundation in 2022, and they interviewed acute care nurses and inpatient bedside nurses. 75% of nurses report feeling stressed out, frustrated, and exhausted. 67% of the nurses reported feeling burned out. Only 19% of nurses agree that their organization cares about their well-being. About 89% of nurses agree that their organization is understaffed, and 63% of nurses say that they intend to leave the profession altogether. So clearly, we can see that these numbers are alarming. They not only harm the other nurses that stay at the bedside, but they also pose a risk to the patients as well. So we're going to talk about why we created our prototype and the goal.
So the problem that we're focusing on is nursing burnout and how it can be caused by a lack of mental health resources available for nurses. We believe that this problem can also lead to other significant healthcare issues, such as the nursing shortages that a lot of hospitals are facing. We chose this problem because we are seeing it right in front of our faces. As nursing students, we see how much work nurses are doing, and it's not something that we're excited to be jumping into. We hope that we could create better working environments that are safe, not only for our nurses' mental well-being, but also for the patient's safety too. So during and post-pandemic, burnout has been a serious problem affecting nurses and other healthcare workers. Being overworked and understaffed, seeing traumatic cases, and having to be overly compassionate to their patients has led many nurses to leave the profession altogether. This puts more stress and responsibility on the nurses that have decided to stay and are still working, which in turn, with all that stress and responsibility, creates more burnout. It's a cycle that just won't stop. In addition to this, we find the hospital systems aren't offering adequate mental health resources to nurses and other healthcare workers. And we believe that if hospitals were to be doing this, we can help solve the problem.
Nursing burnout is a huge issue affecting nurses across the world, so much so that it is even considered a public health crisis. A study by the American Nurses Association reported that more than 50% of nurses are burnt out, and that nursing has one of the highest rates of burnout among healthcare professionals. Nursing burnout can also have serious consequences for patients, including increased rates of medical errors, longer hospital stays, increased rates, lower quality of care. And according to a study published in the Journal of Occupational Health Psychology, nurses who reported higher levels of burnout made more medication errors than their colleagues who reported lower levels of burnout.
Although our proposed solutions already exist individually, we're trying to encourage that they be implemented in conjunction with one another. These solutions in question are things such as the BetterHelp therapy subscription service, materials from the Substance Abuse and Mental Health Services Administration, and the 988 mental health hotline that went into effect nationwide last year. Some may call this radical, implementing all these services at once. We believe it's absolutely necessary in order to make mental health the priority it needs to be. Furthermore, we believe that a holistic approach employing both internal and external resources is the most promising when it comes to tackling such a broad issue as burnout in nurses.
We came up with several ideas to promote mental health and well-being for nurses. First is employing resource staff on every unit. This is a great way to provide additional support to nurses and ensure that they have access to the resources they need and to manage their workload and address any concerns they may have. Next, providing free therapy subscriptions. Offering free therapy subscriptions can help reduce barriers to mental health care and make it easier for nurses to access the support they need. This also helps reduce the stigma around mental health and promotes a culture of self-care. Next, paid mental health days in addition to paid sick days. Paid mental health days can give nurses the time they need to rest and recharge when they are feeling overwhelmed or burnt out. This also promotes mental health and well-being. Next, we have regular check-ins with mental health professionals. Regular check-ins with these mental health professionals can help nurses identify and address any issues that may be experiencing before they escalate into burnout. This helps prevent and promote early intervention and prevents more serious mental health concerns from developing. Next, enforcing safe orientation links for new nurses. A safe orientation link can help new nurses adjust to their new role and workplace without feeling overwhelmed or unsupported. This also helps with reducing nursing turnover. Lastly, we have a 24/7 access to a crisis hotline. A crisis hotline can provide immediate support to nurses who are experiencing a mental health crisis or need help managing a difficult situation. This also prevents burnout and promotes overall mental health and well-being. To demo our prototype, we're going to implement the different measures into a hospital unit and evaluate their effectiveness over time. This could involve monitoring nurse burnout rates, staff turnover rates, patient satisfaction scores, and other relevant metrics. The data collected could then be used to make adjustments to the program and improve the effectiveness over time. Overall, our prototype addresses nursing burnout by providing additional support and resources to nurses. It promotes a culture of self-care and wellness, and it reduces stigma around mental health and can lead to improved job satisfaction, better patient care, and increased retention rates among nursing staff.
Our prototype calls on hospital management to allocate funds towards these internal and external mental health resources that we discussed, perhaps in collaboration with one of the organizations such as BetterHelp that we discussed earlier. There could be a discount program offered for healthcare workers utilizing these services. On another note, it's important to take into consideration the level of collaboration that's necessary to pull this off. For example, hospitals should be putting forward an HR rep or someone of that nature to make sure that we're educating nurses on how to properly utilize and access these services. Ultimately, our prototype requires 100% commitment from all levels, because without it, mental health will continue to fall to the wayside. The issue of burnout in nurses isn't a problem that can only be solved by nurses. It takes everybody.
To conclude, we greatly see the need for better mental health resources for nurses. Burnout is a dangerous concept in healthcare, not only for nurses who are experiencing it, but for also patient safety concerns. We are confident that this is an issue that can be significantly impacted with our prototype. Each member of our team has the skill set to make a difference and wants this issue to be resolved. Claire is very personable and charismatic and can help persuade hospital systems that our prototype is effective and needed by nurses everywhere. Maddie Connolly can help hospital systems figure out budgets and the needs per unit, because different units have different needs. A more critical unit is going to need more mental health resources than an outpatient clinic. Anna is very organized and can help work with already existing therapy services and other mental health outreach programs within the community to partner with us. And I believe that I'm an effective communicator that can work with hospital systems to help train and educate nursing managers and the nurses what resources our prototype offers and what's available. Thank you so much for listening. If you have any questions, you can please feel free to reach out and email us. We'd love to answer any questions that you have. We believe that we can make a significant impact in healthcare by focusing our efforts on supporting and uplifting nurses. Thank you.